Hello everyone, this is the Average Pharmacist here with another video. And like I said before, the reason I made this YouTube channel was to let you guys know about different things that have happened throughout medical history. And another reason I made this YouTube channel was to let you guys know about the different medications you take. So how they work, what are their side effects, things like that. So if you guys want to know about a particular medication, if you leave me a comment below, I will make that my next video. And if you guys will like and subscribe, that'd be great. And also, if you hit that notification bell, you will get a notification whenever I make a new video. So today I'm going to be talking about the AstraZeneca COVID-19 vaccine. I did get a comment where someone asked about the AstraZeneca COVID-19 vaccine and its ability to protect against different strains. So I said, okay, I will go ahead and make a whole video about the AstraZeneca COVID-19 vaccine. So let's go ahead and get right into it. So the AstraZeneca COVID-19 vaccine actually differs from the other vaccines I covered because the AstraZeneca COVID-19 vaccine is not under the emergency use authorization here in America. So in my previous vaccine videos, I did cover what emergency use authorization is. So if you wanted to learn about that in detail, or if you wanted to know about that kind of subject, if you watched those previous videos, it is contained in there. So that being said, if you got any COVID-19 vaccine in America, it's either going to be from Johnson & Johnson, Pfizer, or Moderna. As I said before, the AstraZeneca COVID-19 vaccine does not have emergency use authorization here in the United States. However, it has been authorized in over 70 countries. But that being said, a recent study did link the AstraZeneca COVID-19 vaccine and rare blood clots, and this kind of has limited its use. So basically what a blood clot is a blood clot is a thickened blob of blood that can cause circulation to be blocked. So clots form in response to injuries, and it can be caused by drugs, and it also can be caused by prolonged sitting or bed rest. The COVID-19 virus itself can cause clots also, as seen in this picture here. So clots form, they actually can form in the leg, and they can break off and travel to the lungs or the brain, and this is dangerous and it can be fatal. So what European researchers actually discovered was that certain patients that got the AstraZeneca COVID-19 vaccine actually developed antibodies that activated their platelets, and this caused blood clots. So all of this actually recently happened, and it is a cause of concern. However, public health experts, they still state that the vaccine's benefits do outweigh its risks. So here in the United States, however, vaccine advisors to the federal government, actually they don't see that this AstraZeneca vaccine being used here in the United States, just because we have so many options already. We already have the Moderna vaccine, we already have the Johnson & Johnson vaccine, and we already have the Pfizer vaccine. So they don't really see the AstraZeneca vaccine being used here in the United States. That being said, actually while I was preparing this video, the issue with Johnson & Johnson, their vaccine actually came up in the news. So as of April 12th, more than 6.8 million doses of the Johnson & Johnson vaccine have been administered. And while I was making this video, the FDA and the CDC actually were reviewing 6 cases of severe and rare blood clots that occurred in 6 female patients that got the Johnson & Johnson vaccine. There was actually an additional 9 cases that actually were discovered, so the cases went up to 15 female patients in total. So the clots actually started 6 to 13 days after receiving the Johnson & Johnson COVID-19 vaccine. And the type of blood clot was a cerebral venous sinus thrombosis, as pictured here. So what happens here is that a clot forms in the venous sinuses, and this actually will block the drainage of blood from the brain. As a result, blood cells may break and leak into brain tissues. And this actually will form a hemorrhage. And this actually is life-threatening. So the FDA and CDC said that actually this adverse event is very rare, and if you experience severe headache, abdominal pain, leg pain, or shortness of breath, within 3 weeks after receiving the Johnson & Johnson COVID-19 vaccine, you should contact your healthcare provider. So as a result of all this kind of discovery, the use of the Johnson & Johnson COVID-19 vaccine actually was temporarily paused for 11 days. However, now the CDC and the FDA have recommended resuming its use because they feel as though it is the best interest of the public. So now if you receive a Johnson & Johnson COVID-19 vaccine, there will be a warning about the clots and the vaccine information that's going to be distributed to you. So if you get let's say you get a Johnson & Johnson vaccine next week, a Johnson & Johnson COVID-19 vaccine next week, what they're going to do is they're going to probably give you a pamphlet that's going to warn you about the clots, warn you about its signs and symptoms, and when to reach out to your doctor. So I know we did take a little break from the AstraZeneca COVID-19 vaccine. Just the Johnson & Johnson COVID-19 vaccine stuff kind of was more recent. I did want to touch that a little bit, and that is a similarity between the AstraZeneca vaccine and the Johnson & Johnson's COVID-19 vaccine, was that those clots are kind of seen in both these vaccines. So let's go ahead and kind of get back to AstraZeneca, their vaccine. So even though I said that these vaccines advisors don't see that AstraZeneca's vaccine is going to be used in the U.S., AstraZeneca is still going to send their vaccine to the FDA to see if they can be used in an emergency use authorization here in the United States. So we'll just see what happens, what data the FDA will look at, and if they go ahead and approve it, the AstraZeneca vaccine will be used in the United States for emergency use authorization. But if they don't approve it, we will not use the AstraZeneca vaccine here in the United States for the emergency use authorization. So the vaccine is used in patients 18 years and older, and it's given in 2 doses, just like the Pfizer and the Moderna vaccine. So with the AstraZeneca COVID-19 vaccine, you get 1 dose, and then your second dose you get 4 to 12 weeks later. So just like with all the other COVID-19 vaccines, if you're going to start with the AstraZeneca vaccine, you're going to finish your vaccine series with the AstraZeneca COVID-19 vaccine. So you're not going to start with AstraZeneca and finish with Pfizer, and vice versa with the rest of the vaccines, just because there's no data showing the interchangeability of COVID-19 vaccines. So the side effects with all the vaccines are very similar. The only difference being that the Johnson & Johnson COVID-19 vaccine and the AstraZeneca COVID-19 vaccine have this clotting side effect. However, besides that, all the side effects are very similar. So the way that the AstraZeneca COVID-19 vaccine works, it actually works just like the Johnson & Johnson COVID-19 vaccine. So the AstraZeneca COVID-19 vaccine is a viral vector vaccine. So as I explained before in my previous Johnson & Johnson COVID-19 video, coronaviruses like COVID-19, they're named coronavirus because of the crown-like spikes on their surface. And these are called spike proteins. And these spike proteins are actually ideal targets for vaccines. So basically what a viral vector vaccine will do is it will use a harmless version of a different virus called a vector. And what happens is this vector will deliver information to the body, and it will teach your body how to make copies of the spike proteins. So later, if you are exposed to COVID-19, your body will recognize it, and it will know how to fight it off. So the AstraZeneca COVID-19 vaccine does not contain the virus that gives you COVID-19, and it can't give you COVID-19. Also, the vector, which is a virus, can't make you sick, and it can't change your DNA. So when your body responds to the vaccine, you do get those symptoms, like you kind of get some tiredness, some muscle pain. This is normal, and it's showing that the vaccine is working. So in regards to protecting against other strains, I really didn't see anything that showed that AstraZeneca's vaccine can protect anyone better than the other vaccines against these different strains. So the mutant strain that was first seen in the United Kingdom, this is the predominant strain here in the US now. So it has been found in at least 130 countries also, this same strain from the United Kingdom. It is believed that the Moderna, Pfizer, and Johnson & Johnson vaccines can protect against this UK strain. There is, however, another variant that has been seen in South Africa and other South African countries. So some trials have been done showing that COVID vaccines do have effectiveness in preventing this South African strain. So one trial which used the Johnson & Johnson COVID-19 vaccine found that this vaccine was about 85% effective in preventing severe disease from this variant that's dominant in South Africa. Another study using Pfizer's vaccine actually suggested that the Pfizer vaccine will prevent as much as 100% of even mild cases of this South African variant. And lastly, there was another study done with AstraZeneca's vaccine, and that study suggested that the AstraZeneca vaccine may have almost no ability to protect against strains causing this mild disease in this South African variant. So, really there's no research showing that AstraZeneca's COVID-19 vaccine will protect you better from different strains than the other vaccines. I just didn't see any data showing that. So I like to keep my videos short. I hope you guys enjoyed it today, and I hope it was a lot of information for you guys, but it was hopefully beneficial for you. Like I said before, we're not using AstraZeneca right now in the United States. What's going to happen is they're going to go ahead and send their data to the FDA, and we'll see what happens. If the FDA likes what they see, then they will accept their emergency use authorization, and we'll see it used here. However, if the FDA doesn't like what they see, they will probably deny their emergency use authorization, and it won't be used in the United States. So if you guys have any questions on any particular drug, or you want to learn about something new, just leave me a comment below, and that will be my next video. And if you like and subscribe, that'd be great. Also, if you hit that notification bell, you will get a notification whenever I make a new video. Hope you guys enjoy the rest of your day, and I hope you guys have a great week.